Hi, I'm Dr. Erik Lough, answering common questions patients ask me about general and weight loss surgery. Today I answer the question, what is the pre-op diet for weight loss surgery? The pre-op diet is a low carbohydrate, high protein diet for 2 weeks prior to the operation. The purpose of this diet is to use up all the stored carbohydrate in the liver, known as glycogen. Depleting your liver's carbohydrate stores shrinks the liver, which makes for a more ideal situation during the operation. Anatomically, the liver is basically just lying on top of the stomach and the small intestine, which is precisely where I need to be when I'm performing a gastric sleeve, a gastric bypass, or a duodenal switch. If the liver is too big and I can't retract it out of the way, I may not be able to safely complete the operation without an increased risk of complications or bleeding from the liver itself. Worst case scenario, it might be safer to abort the procedure for now and come back at a later time when we can try to get the liver to shrink more. For 2 weeks prior to the operation, the main focus will be on limiting carbohydrate to 30 grams per day. A patient can do this by shooting for 70 grams of protein, 30 grams of carbohydrate, and fat in moderation by avoiding fried foods, butter, fatty meats, and lastly by avoiding alcohol. You may also want to use protein drinks or protein bars, but just make sure you read the nutrition label to make sure that it's low in carbohydrate. We provide our patients with a sample grocery list and a menu for 7 days, which can be repeated to get to 14, which include foods like meat, cheese, nuts, eggs, peanut butter, and vegetables. Avoiding excessive bread, cereal, pasta, fruit, and milk is key. The pre-op diet is also a great time to practice your new dietary guidelines, such as chewing 30 chews per small bite of food, avoiding liquid calories, and avoiding drinking at meal times, while trying to hydrate throughout the day with sugar-free liquids in between meals. Some patients are worried that the whole 2 weeks pre-op diet is liquid only, but that's not actually true. Only the 1 day immediately before surgery requires a sugar-free liquid diet. Then you have nothing to eat or drink after midnight before surgery, and your liver will be nice and shrunk down just in time for the big day.